Hello, this is a tutorial on the 1020 system. We're going to cover basic concepts, terminology, electrode placement, and measurement principles. A measuring tutorial will be separate. So what is the 1020 system? It is a measurement system. It is not a pattern or template. It's measured in centimeters and millimeters, and it is based on percentages of the measured distance between two pairs of anatomical landmarks. The first pair of anatomical landmarks are inion, here, and nasion, here, measured over the top of the head. The second pair are the left preauricular and right preauricular, here. This is the external auditory meatus, or the ear hole. Right in front of it is the tragus, little tab on the ear. At the top attachment of that tab is where our measuring point is. We're going to go from one side to the other side and get a total distance in centimeters. This system is an internationally agreed upon method for standardized electrode placement. It is officially known as the International 1020 system, and this is a system that should be consistent between technologists no matter where you are in the world, no matter what continent you're on. This should stay reasonably consistent. There may be a little bit of variation, but the point of this is that if you have an EEG done on safari in Zimbabwe and you have to get emergency care and they take you to France, theoretically they should be able to use that EEG. That's probably not going to happen, but it should stay consistent, and this is very important that it stays consistent, because in a facility like ours where there are surgeries and we do stage 2 where they implant the electrodes and recording devices, and stage 3 where they do resections, they base the stage 2 surgery on the EEG done with these external electrodes. It's very important that you have these on the correct side of the head based on the numbering system that we'll get into. You have them evenly spaced. Things are not switched. This has a lot of significance, so please do take that to heart. A couple of things I want to point out here on our MRI slide. It's reversed from our illustration. This is our inion point. This is the external indication of where this structure, this white line, this is the tentori cerebelli. This divides the cerebellum from the cerebrum, and this right here is the occipital lobe. We have got to be above this when we record. This is very important, and this is why we use inion. Nasion is here. It is at where the bridge of the nose gets to its point where it is very recessed here between the eyes and before it climbs back up to the eyebrow. It is not the eyebrow. It's not anything higher than that. It is right here. If you have trouble finding inion on a patient, clinically we'll see it's either on a level plane straight back if the patient was standing up, or below. It should not be above. If you think you have found inion and you look at the side of the patient's head and you're well above the eyes, if the patient were standing up, you're too high. And you definitely don't want to be anywhere down here. If you're feeling muscle or fatty tissue, you're probably too low. You should feel the skull. The scalp should be very thin. You don't want to be down here and then measure up, because then you might end up here and you're not going to be recording what you're supposed to be recording. You'll have more of a reference electrode rather than an occipital electrode. All right, let's talk about how this system works. The numbers 10 and 20 refer to percentages of the distance in centimeters between our anatomical landmarks, and fractions of centimeters will be in decimals and be millimeters, but we're going to refer to them as centimeters in here. Each location in the system possesses a unique alphanumeric designation consisting of a single letter or pair of letters and a numeral. The letters represent the name of an area of the brain that the placement corresponds to. The numerals indicate the proximity of the location to the midline, with larger numbers representing a greater distance lateral from the midline. Now this is referring to this diagram here. This is the updated system. There is a guideline that I will have referenced on this slide from 2016. And we see there are 7s here, there are 3s here, and then there's the 1 and 1 would be theoretically closest to the midline because they're only going to be a 5% 5% distance, whereas this is a 20% distance, and we'll get into those numbers. But theoretically, the 1s are closer to the apex or your midline with Z, and then you've got your 3s going out to your parasagittal, and then your temporal chain is going to be your 7s. You see the old system here, T5, T3, so both of these are temporal. P7, T7, these are temporal, and we'll get into the reasoning why those have the letters that they have. The numerals also represent the left and right sides of the head, with odd numerals denoting the left hemisphere and even numerals denoting the right hemisphere. This is extremely important. You need to be sure that you don't cross these up. It is not your right and your left. It is the patient's left, patient's right. When I do the tutorial on setting this up, I'll get into some things on how to make sure that you don't confuse this just by process. Some people forget and can't remember, is left odd, is left even. A couple ways to remember this. The word odd in the sense of being unusual, it is odd to be left-handed. Odd numbers are on the left. Also, we read left to right, and just as it is here, left to right, 1, 2, 3, 4. Left to right. The first one's on the left, second one's on the right. Location names containing a Z represent a component of the midline, and Z can be considered to mean 0, and it is also referred to as the apex at CZ. All right, the letters have a purpose elsewhere as well. FP denotes the frontal polar leads, which are placed to record the frontal polar region of the frontal lobes, which rest just superior to each eye inside the cranium. These should be placed fairly close to the eyebrows. They shouldn't be way up on the forehead. They should definitely not be close to the hairline. F3, F4 should be around the hairline. Sometimes on patients it's on skin, sometimes it's between hair. We're always going to be on skin, but sometimes the hairline's up so high that F3 and F4 and FC are on what appear to be the forehead, but it's just the hairline is higher than on some people. They should not be on the eyebrows. There definitely needs to be some space there, and we'll get into that with the measuring tutorial and the setup tutorial. F denotes the frontal leads, which record from the frontal lobes. These leads run from F7 to F8, and together they represent a chain of leads. The anatomical terminology would be coronal. However, in EEG, we refer to this as a transverse chain. There are texts that are using the word coronal now, and I believe that the guidelines have changed to start using the word coronal. But just remember, coronal, transverse, same thing. And so we're talking about F7 up and over to F8. This is a chain because they will be connected to each other as we record. And your measuring assessment will be based on these chains. How consistent are you going this way? How consistent are you going this way? And that's going to make a difference on whether or not you can pass a measuring assessment. C denotes central leads and corresponds roughly with the central sulcus of the cerebrum. This is the dividing line between the frontal lobes anteriorly and the parietal lobes posteriorly. Surface anterior to the central sulcus is the primary motor strip, and surface posterior to the central sulcus is the primary sensory strip. So what we're talking about here, central sulcus wouldn't go down to T3. The temporal lobe cuts that off with the Sylvian fissure. And so it's about here, up, and that's the left side's central sulcus. And then there's a division here, and then a whole nother hemisphere that's not attached. It is separated. Goes from here down to here, and This is also referred to as the Rolandic area, and you'll see the term Rolandic typically in some older texts, but it's still around. This is important with some childhood EEG things that we're going to get into at some point. All right, and to follow up on that last slide, this is the midline, and this is the central line. So it's important to remember those, because when you hear central, it's easy to think of the midline first and foremost, but just remember central and mid are two different things. All right, T denotes the temporal lobe, and P locations with the numeral of 7 or greater represent the posterior temporal lobe. So they're both going to be temporal. Just remember that P with the high numbers represents posterior temporal. And we can see that here between the two on the old system. T5, clearly temporal, and P7 is what it's changed to, posterior temporal. P8, posterior temporal, used to be T6. Our head box in our lab have this new system. Lots of head boxes still have this old system. We do have some that have this old system as well. You just need to know that they're both, and you need to know how to talk about both back and forth and not get confused. And in conversation or for a moment, it may throw you, but just get yourself back on track and remember that P7 and T5 are the same thing. P8 and T6 are the same thing. That's really the only difference on that update. Well, the numbers on the temporal lobes changed slightly. So T3 became T7 and T4 became T8. But it really pertains to the temporal lobes with the main changes. All right, P locations with the numeral of 6 or less denote parietal lobe placements. So we're talking about these here. It's a small area that we have designated for the parietal lobe. And O locations represent the occipital lobe placements. And that is what we were talking about earlier, the area that is just superior to the tentorium cerebelli, or the meninges that divide the cerebellum from the cerebrum. And here's the reference on the updated guidelines. And this is the 1020 system representing the anatomical areas of the brain. This was borrowed from Maggie Marsh Nation, and it's just a good illustration to give you a visual concept of what we don't see. As you can see, inion here, we want to be up above it enough to record the occipital lobe specifically. All right, 10% region. So there's a 10% region and a 20% region. This is why it is referred to as the 1020 system. The 10% region forms a ring around the head and is also known as the hat band. This area is located 10% superior to the anatomical landmarks used. So it's 10% of the distance between these primary anatomical landmarks. Inion to Nacian, we're going to be up 10% of that total distance from both of those. Also from preauricular to preauricular, we're going to be up 10% of that total distance. All right, so if inion to Nacian is 40 centimeters, then OZ and FPZ will be placed 4 centimeters superior to these landmarks. If you struggle with percentages, you got to find a way to make it simple for yourself. You just put a decimal point in between your two numbers here. We're only going to be dealing with 2-digit numbers. I've never seen a Nacian to inion that was 40. We're using these for round numbers. They're going to be smaller. You're going to be looking at like 38, 37, 35, 34, that sort of thing. So you just put a decimal in between there. That's your 10%, and you go up from each of your landmarks 10%, inion and to Nacian. So similarly, if left preauricular and right preauricular are 35 centimeters, put your decimal in between those two numbers. You've got 3.5. T7 and T8 will be placed 3.5 centimeters superior to these landmarks. So these are two independent distances, inion to Nacian, and then preauricular, preauricular, over to preauricular. So everything in the 1020 system is going to be crosshairs. So we've got kind of a big crosshairs here. And this isn't, again, a tutorial on how to measure. I wouldn't start with the hat band, but this is how we're going to discuss it here on the explanation. All right, each location around the ring is equally spaced by 10% of the circumference of the skull. So again, another reason why we're referring to this as the 10% region. We have 10 locations, we've got 10 spaces in between them, and they're going to be evenly spaced by 10% of the circumference. Okay, so if the circumference is 60 centimeters, then each location will be placed 6 centimeters apart, resulting in the 10 locations evenly spaced. FPZ and OZ are not included in this hat band, and they're in fact halfway between the locations that are included. So when we measure, we're measuring our first set that go in the hat band. We're going to put these two down, and there's going to be that 6 centimeters, or 10% of our 60 centimeters, and our 3 centimeters is going to sit right here. It's going to be a centering point. We're going to have 0 and 6. That gives us 6 centimeters, and then we're going to go all the way around. Well, we're going to go one side, then we're going to go the other side, and that will give us our even spacing, centered above the eyes and above the bridge of the nose. Each half of the hat band represents what is known as a chain of electrodes. These chains are important for assessment of measurement accuracy, as well as the display of the EEG tracing that we will create. These two chains that together make up the hat band are known as longitudinal chains because they run from anterior to posterior. We spoke earlier about the transverse or coronal chains, and then these are longitudinal, front to back. These longitudinal chains are also designated as the temporal chains, so we would refer to these as the temporal chains when we're analyzing EEG. They'll be displayed together on the recording, and in talking about where we see something occurring or an abnormality, to give the person that we're speaking to and looking at the EEG with some context, we will typically say in the temporal chain or in the parasagittal chain, left temporal chain, right parasagittal chain, so that they know where we're talking about. Any electrode placement can belong to more than one chain. This is important too. Don't think that because FP1 is in the longitudinal chain that it can't also be part of the hat band chain. The hat band can also be a chain. All right, superior to the 10% region, we have the 20% region. The electrode placements superior to the hat band are double the distance the 10% electrodes are from the anatomical landmarks which they are in proximity to. So using our earlier example of 40 centimeters between inion and nasion, our 10% locations are 4 centimeters superior to these landmarks, and our 20% locations are then spaced 8 centimeters apart, starting from OZ and then to PZ and then to CZ, then to FC, and then to FPZ, and then FPZ will be the 4 centimeters from nasion. So we have 10%, 20%, 20%, 20%, 20%, 10%. That adds up to 100. I'm not going to do the math, but you can play it back slow if you want. The reference electrode and the ground electrode are not part of the measuring system, and they can theoretically be placed anywhere, and they're displayed here just so that we remember to talk. Okay, so if we're asked to determine the distance between OZ and FC, we would add up these three 20% distances, which are all equal. In this example, they equal 8 centimeters each. So we're going from OZ, which is 4 centimeters up, or 10% up from our landmark, and then we double that distance. 4 centimeters doubled becomes 8. And then we're going 3 increments from OZ to PZ, PZ to CZ, CZ to FC. We have 4 locations, but we have 3 increments, 8, 16, 24. If we were given that the distance between Nacion and FPZ is 4 centimeters, so we're going the opposite way, from Nacion to FPZ is 4 centimeters, and asked what the distance between PZ and FC is, we know that we're going from a 10% increment from Nacion to FPZ, and then we're being asked about two 20% increments, PZ to CZ to FC. These are 8 centimeters. So we have 8 and 16, 8 times 2. Taking a 10% amount that we're given, we double it to get a 20% amount. We know that we have two 20%. We add those together, and this is the math here. I'm putting this on here because this is the way that it will be asked on the board exam. So just keep that in mind. If you learn how to work with the numbers this way, you'll be just fine on the boards. You won't have to relearn it the way that they want you to know it. Remember, the 10% increment might be given. They'll ask you to find the distance between some 20% increments. You just need to be able to jump around with that math pretty quick. All right, so the same holds true for our measurements between the pre-auricular points. In the earlier example of this distance being 35 centimeters, it illustrates that the distance can differ from our inion to Nacion distance. However, there are many times that you will find these measurements to be the same. Don't get lazy and just measure one and then you put it on the other one. It doesn't work that way. They will be different many times, and you don't know until you measure. The distance between the electrodes in this transverse chain will then be 7 centimeters. So if we're given a distance of 3.5 centimeters, that's 10% of our 35, between the right preauricular and T8, we might be asked what the distance between T7 and CZ is. So we're given a 10% amount, 3.5, and we're going to be asked what the distance is between two 20% marks, which is going to be 20% is 7, so we add 7 and 7, that gives us 14. All right, the explanation is here if you want to read that. Okay, so every electrode placement is determined by finding the point where two midpoints between adjacent electrodes intersect. So we're talking about two midpoints between two different sets of electrodes. Now we measure these in chains, we mark them in chains, but this is a way to illustrate how these are spaced on an individual level. And everything is going to be crosshairs. Everything is going to be like looking through the sight with a crosshair trying to find something, and that's what we're doing. So F3 is midway or equal distance from F7 to FZ. So we're talking about F7 to FZ. We want to know what's half the distance, and that's in the transverse chain. It is also midway or equal distance from FP1 to C3 in the parasagittal longitudinal chain. All right, so this line here that we're seeing would be half the distance between FP1 and C3, and so that crosshair would be there, and it's going to be just a little mark on the scalp. It's not going to be that big when we mark it, but this is for clarity. And then half the distance between F7 and FZ is represented by this line here, and as you see, we have a crosshair. We put our electrode right there. Okay, C4 is midway or equal distance to T8 and CZ in the transverse chain. It is also midway or equal distance from F4 and P4 in the parasagittal longitudinal chain, and we have that illustrated here. And it's going to be this way with every electrode placed in the 20% region. All right, symmetry between the right and left hemispheres is also a very important concept. In the above examples, if we were to mirror F3 with F4, then the distance between F4 and FC should be equal to the distance between F3 and FC, and so on for all corresponding placements. So in our earlier example of given the 10% distance here and then being asked for what's the distance between two increments of the 20%, on the opposite side of the head, that's illustrating this point that we need to be symmetrical. So anything that's going on one side of the head needs to be going on equally and mirrored exactly on the other side of the head. All right, so there's some additional electrodes here. In addition to the measured electrode positions, we also use reference electrodes. Some systems, such as the Natus Brain Monitor that we use at our lab, use system reference. It is its own electrode. Some systems use a different setup where you don't have to have that specific reference electrode. This electrode can be placed anywhere on the scalp, but by convention it is typically placed between PZ and CZ, right there. All systems also use the M1N2 or A1A2 electrodes. In our lab we use M1 and M2, and then we end up referring to them as A1 and A2 because that's the way that they're made up on the montages that we monitor on. But they're used interchangeably as we talk, but there is some difference. So M stands for the mastoid process, and this is the bony bulge typically found behind one's ear and is a portion of the temporal bone of the skull. A stands for auricular, and the electrode is placed on the earlobe with this one. And then we also have the ground, and we typically will place it between CZ and FC. It's not super important on the reference and ground. These can be manipulated on the placement depending on the situation. Small children, a lot of times that midline gets really crowded, and so the reference on the ground can be put in a different place depending on that, and we'll get into that on a tutorial about setting up. All right, so if we use the M placement, we do not use the A and vice versa. It's either or. If we use M1 on the left side of the patient, we must use M2 on the right side. We do not use M1 and A2 on the same patient or a different combination. So the M placements are preferred over the A placements, but there will be situations where you as a tech will not be able to access the mastoid process due to patient positioning or a life support device, something like a strap around the patient's head to hold the tube for the vent. You just go with the earlobes and it'll be fine. Every system also requires a ground or a common electrode. This is not a patient safety electrode. This is very important to understand this for the board exam and to assure your patients if the word ground gets mentioned. There is no charge that will be applied to the patient. The machine is isolated from our breakout box that connects to the patient. This is simply to remove charge from the surface of the skin. The charge that's on the surface of the skin, the free electrons, will vibrate with the alternating current that's filling the room. And so if we can pull some of this charge off, it'll help reduce the 60 hertz that blocks our signal that we're trying to record. And again, we'll get into that more later. And this is where the ground electrode is typically placed, as we said earlier, between CZ and FC. All right, that's the end. My name is Benjamin Erickson, and here's my contact info. If you have any questions, complaints, or anything else, let me know. Thank you.